Hello and welcome. Today is going to be an introduction training for the provider portal. In today's training, the two main objectives are going to be how to discuss to register for the provider portal itself, and also we're going to review some key functionalities the provider portal has to offer. The provider portal is a very user-friendly and easy website to navigate. It will allow you to submit authorization requests while simultaneously checking authorization statuses along with claim statuses. The provider portal also enables you the ability to check member eligibility information. Now we will discuss how to register for the provider portal. The link to the provider portal will be found on the plan website. Once on the plan website, you will then navigate to the Providers tab. Click the link to log in/register for the provider portal. When you reach the home/login page for the portal, you will then click Create an Account. A license agreement screen will appear. Click Accept and then click Next. For the next screen, complete the following fields at a minimum: first and last name, your MPI, and your TIN. Please note that it is preferred to complete all fields. Once all information is entered, click Add Provider at the bottom of the page. If you only wish to add one provider, click Next. If you wish to add another, repeat steps 5 and 6. The added provider will be listed near the top of the page once completed. Next, you will complete the steps to create your username and password. You will then add a valid email address, along with answering 3 security questions. Please pay close attention to any errors received when reaching and creating a username and password. The password section will remain highlighted even though it may not be the issue. Verify that that error is not within the username or security questions. After clicking Next, you will see the following page. It'll present your username, first name, last name, email address, and the MPI and TIN used. Verify the information on this page is correct and then click Finish. If any edits are needed, click Previous and you may edit as required. You have now registered successfully for the provider portal. After you have successfully registered for the provider portal, the user will immediately be directed to the provider portal homepage. On the homepage, you will see all the contact information for the plan, including the customer service phone and fax number, along with an FAQ hyperlink section to the right. At the top of the homepage, you will see the Eligibility tab, the Claims tab, the Authorizations tab, and the Form and Resources tab. Click these tabs to navigate throughout the provider portal. The Eligibility tab will enable users to search member eligibility information. This information includes accumulators for the member's supplemental benefits and will also tell you the allowances met towards the member's max out-of-pocket and deductibles. At the top of the eligibility screen, you will see a Select Provider drop-down in which you will be allowed to select your individual MPI. However, we suggest it's best practice to leave this drop-down as selected as all providers to increase your search options. There will be 2 ways to search a member. The first and easiest way will always be by the member ID. If you do not have the member ID available, you will be unable to search a member by their first name, last name, and date of birth. If you wish to search multiple members at once, please enter them in a list form by clicking Enter. You will know a member is successfully searched when you see their name hyperlinked at the bottom, which will present their member ID, their PCP, and their current plan status. provider portal also has the ability for a user to submit a provider portal request. Anytime a member, a claim, or an authorization is searched, a hyperlink in the middle of the screen will appear for a user to submit said request. This will allow the user to ask any detailed questions concerning the member's eligibility, their claims, or authorizations. Typically, a timely response from the provider portal team via their email is 1 to 2 business days. Next is the Claims tab. This will enable users to search for members' claims and check their statuses. There are 2 ways to search claims in the provider portal. The first and easiest way will always be by the claim number itself. If the claim number is not available to the user, then you will use the member ID, the date of birth, and the date of service beginning and end date. Again, if you wish to search multiple claims, you will use the same form as the members and enter them in a list form. Next, we will navigate to the Authorization tab. Here, the user will be presented with 2 different sides of the screen. To search for a submitted authorization request, the user will use the left-hand side of the screen and complete all required authorization request details. We do suggest to leave all options as is. This will ensure the provider sees all authorizations submitted from within and outside the portal. All authorization statuses that show pending indicates that the authorization has been received and is under review by us. The right side of the screen is where a user will be enabled to submit an authorization request. All Part A services will fall under the inpatient authorization hyperlink. It's important to note if you do submit an authorization request for a provider that's not added to your account, you will be unable to see that request status unless you add the affiliated TIN and MPI of that authorization to your provider portal account. The user will then be presented with the following screen when submitting a new authorization request form. At the top of the screen, the first option will ask you to select your priority status. It's important to note that you will only select the expedited priority if the time for the decision of the authorization request puts the member's health at risk. Next, you will select your service type. Your service type will be dictated based off the type of auth request you selected on the previous authorization screen. After, you will fill out all necessary requested information. Anything noted with a red asterisk is required. Under your review type, select Extending if you wish to add additional days to your authorization request form. At the bottom of the screen, you will be able to upload all supportive clinical documentation. Submitting an authorization without clinical documentation may delay the authorization decision or may result in a straight-up denial due to lack of clinical support. Our nurses will review uploaded documents to ensure that the requests for services are medically necessary. After all clinical documentation is uploaded and your required information is filled in, complete your attestation by making sure all information is being submitted in truth and checking the box. Lastly, you will click Submit Request. After your authorization request form has been submitted, a receipt of transaction will display on the screen. The Forms and Resources tab will have a link directly to the plan website. By clicking this link, it'll let the user seek all additional plan resources, including member/provider plan documents. This will be combined with all request forms, including all authorization request forms, referral forms, EFT forms, and drug referral forms. You will be able to see all documents such as member summary benefits, required prior authorization grids, pharmacy directories, and provider manuals. The Forms and Resources tab is a great place for a user to navigate to have all plan information at their fingertips. The user dashboard will display a message icon in the top right corner of the Provider Portal website. Here, a member will be able to see any confirmation for all requests/referrals submitted. It is important to know that you will not receive a response to your Provider Portal request in the message icon. All portal inquiries will be answered via email. For maintenance, to clear any notifications, click the message itself and update the status. This will archive it away. The profile icon can also be found in the top right of the Provider Portal website, right next to the message icon. This will display all user account information. It will also give the ability for the user to change their password, update security questions or contact information, and most importantly, let the user add or delete TIN/MPI combos associated to their profile. We have now successfully navigated through the Provider Portal. For any questions, please contact our customer service team or our Provider Portal admin team at providerportal@curanahealth.com. Thank you for listening.